The Sim National Center has multiple responsibilities. We focus on the big picture strategic plan for simulation-based training across the entire VA system.
So we're the hub of what's going to be a national simulation network, and that's what really sets us apart from all the other simulation centers around the country.
By using simulation, we're continually updating ourselves through the use of subject matter experts, through the use of our curriculum.
So the mission of SimLearn is twofold, and it's important to realize it's improving or maintaining the skills of the healthcare providers with the ultimate goal of improving veteran and patient outcomes.
As part of that initiative, we develop national curricula, we develop national policies, we do national acquisition of simulation-based equipment to provide to the field.
Like the rest of employee education system, we're using the ADDIE model for instructional systems design, which is analysis, design, develop, implement, and evaluation.
So we use our subject matter experts and the people here at SimLearn and instructors that we have from the other facilities, and we then start going through the model and developing a curriculum.
We do the initial front-end analysis, figure out what the training gap is, design the solution, we go ahead and develop, we build it, and then we get it ready for implementation.
One of the benefits of simulation is to go over a procedure, to demonstrate the procedure, learn competency before we actually have to do the procedure on a patient.
We get instructors nominated by their local facility to come here and learn to be trainers. It's the same model that the military uses for their fighter weapons schools. I tell all the students that they're the real Top Gun instructors. We'll teach them everything they need to know. We've already bought their equipment and it's ready for them back at their facility. They go home and deliver the course.
We are also looking to support the standardization of some delivery of care through training. So some of those efforts include the READY program, which is the Resuscitation Education Initiative, where we are standardizing ACLS and BLS training across the entire VA system.
SimLearn, we like to roll out the programs and our educational courses interprofessionally, because no matter where anyone is working in the VA, they're working with a team of other people. They're not really working by themselves.
So what simulation allows is for these different types of providers to practice these teamwork and communication skills in a safe simulated environment. So when they get to the patient, they're extremely experienced and skilled in providing the type of care that the patient deserves. Some of the things that we are piloting here at SimLearn include remote simulation operation capabilities with video debriefing.
We need to call a code.
Larry is able to run the mannequin out of the National Simulation Center in Orlando to the Sheridan, Wyoming Simulation Center. What this allows us to do is distance-based simulation to support many of our remote simulation centers in the VA. We're also evaluating some of the advanced surgical procedural trainers to see where they can fit in training our providers. We're also piloting some easier technology of delivery of simulation, such as the SimPad.
Every site that's affiliated with READY gets an ALS mannequin as well as a SimPad, and this SimPad is already pre-programmed so they can give a standard level of training throughout all of the facilities.
The ultimate goal where we're headed is to construct a 51,000 square foot immersive training facility. You'll walk in the door and down one wing, it'll look like any VA clinic. You'll walk down the other wing, it'll look like any VA hospital. We're going to be able to train in a safe environment. We're not going to train on patients. We're going to train on simulators. There's not a bad thing that can happen. I'm going to be able to pick what I want to teach today. I'm going to be able to do it in a safe environment, and I'm going to be able to do it repeatedly.
We feel that the SimLearn program in the VA is really leading the way in healthcare-based simulation throughout the country. Our goal is to provide the best possible care to our veterans through simulation-based training.